Today, routine colon cancer screening begins at age 45. If you are over 45 and haven't had a screening colonoscopy yet, welcome to the club. Few people realize that colon cancer is the second leading cause of cancer death in the U.S., after lung cancer. In fact, among non-smokers, colon cancer is now America's #1 cancer killer. Even more concerning is the fact that colon cancer is appearing earlier than before. Older adults still remain the most at risk, but we have also seen a steady increase in cases among younger adults. This graph illustrates the sharp increase in colon cancer among adults under 50, which led to updated national guidelines in 2018 recommending screening colonoscopy starting at age 45 instead of 50. Here's the good news. You don't need to have symptoms. Screening works best when you feel completely fine. Here is a key point. There's a world of difference between detecting a cancer and preventing a cancer. Most cancers, such as breast cancer, prostate cancer, and lung cancer, are detectable but not preventable. You need to have these cancers before your doctor can detect them. Colon cancer is unique because it can actually be prevented. This is because it develops silently, starting as small benign growths known as polyps, which can take years to grow and potentially become colon cancer. The solution is simple. Find and remove the polyp before it turns into cancer, and that future cancer is prevented. Unfortunately, polyps cause no symptoms such as pain, bleeding, or other warning signs. By the time symptoms show up, it's often advanced colon cancer. It is best to get checked before any symptoms show up. That's called screening. This is why colonoscopy was developed over 60 years ago. To help your doctor find and remove any polyps before they become cancerous, find and remove the polyp, prevent the cancer. That's the miracle of colonoscopy. You might wonder why you shouldn't choose the stool test advertised on TV, like Cologuard or the newer Shield blood test. The main point is this: these tests are designed to detect colon cancer, not prevent it. They are meant to find cancer once it has already developed. For example, blood tests can detect most colon cancers, but they miss 85% of precancerous polyps. Someday, stool and blood tests might reliably detect polyps, but that technology isn't available yet. Colonoscopy remains unique because it allows us to find and remove polyps before they turn into cancer. That is prevention, and that's its real power. Let's briefly discuss the preparation, or prep, since that's where most concerns come up. A good prep helps your doctor find and remove precancerous polyps more effectively. The prep isn't painful or harmful to your colon. Its goal is to clean out the colon temporarily for clear visibility. Most people find it inconvenient but not unbearable. Modern lower-volume preps are now much easier to tolerate than they used to be. Most are taken in split doses, with part taken the evening before the exam and part on the morning of the exam. This approach improves comfort and, more importantly, the quality of the exam. The procedure takes place in a specialized endoscopy unit within a comfortable medical environment, conducted by a team that performs this daily. You're in good hands. There's no reason to feel embarrassed. They've seen it all. Just relax and focus on the peace of mind you'll have once it's over. Led by board-certified anesthesiologists and certified registered nurse anesthetists, you will be comfortably sedated during the approximately half-hour procedure. Most patients sleep through it completely. It's probably going to be one of the best naps you'll have this decade, and thanks to modern anesthesia, recovery afterward is quick. As mentioned, a colonoscopy is not just a diagnostic test. If a polyp is found, it can usually be removed during the same 30-minute procedure. Here we see a typical precancerous polyp discovered during a routine screening before it becomes cancer. A wire snare is placed around the base to cut and cauterize the polyp. There's no pain and no bleeding. The polyp is then retrieved and sent for biopsy. Find and remove a polyp. Prevent cancer in a matter of seconds. Again, that's the miracle of colonoscopy. After the procedure, recovery is quick, and you can return to normal activities the very next morning, knowing you've checked off one of the most important health decisions you can make. If your exam is normal and you're at average risk, you typically won't need another colonoscopy for 10 years. That's a decade of peace of mind. When polyps are found and removed, that information helps customize the safest follow-up plan for you. The timing depends on your personal risk factors and what we find, including the type and number of polyps. A shorter interval, such as 3 or 5 years, doesn't mean something went wrong. It means screening worked and lowered your future risk. This is one of colonoscopy's strengths. It's not a one-size-fits-all approach. It's personalized prevention. So, if you're over 45 and haven't had a colonoscopy yet, ask your doctor, why not? Give yourself and your family the gift of peace of mind. Check it off your list so you can focus on the moments that matter.